Hi everyone, so today is day 4 of the conference and we're here with yet another amazing participant and speaker at the conference. So hi there.
Hi, thanks for having me.
Thank you for agreeing to interview. Could you just share your name and your background and whether it's your first time here at the conference?
Sure, so I am Samudragupta Bota. I am from India, but I live in the US. I work at University Hospitals and Case Western Reserve University. So I'm the founding director of Health Services Research Center at University Hospitals, and I'm an associate professor of pediatrics at Case Western Reserve University School of Medicine. And this is my second time at the conference.
Oh wow, okay, so you do have a background of being here before, and what are your thoughts on the conference?
Oh, I love it, and it was really difficult for me this time to fit in the schedule, and I prioritize it because I see great value in the conference. I believe in the philosophy of this whole conference. It's very different than the large academic meetings that that I traditionally attend, and it's fantastic. I would say it's the best conference I have attended in this field. Yeah.
Okay, so you're a psychologist by background, correct?
I am, yes.
But then you also do neonatal related work.
That's correct.
Okay, and so what do you think sets this conference apart from other conferences, and what were your sessions like during this conference?
Yeah, just to set it straight, so although my professional background in psychology, I have only worked in pediatrics, and so basically my baseline or my reference standard is really pediatrics and neonatology meetings, so very similar to in content to these meetings, so, and I can only speak for that. So what sets us different is, I think, the focus. So we are focused exclusively on problems specific to the continent. So clearly, neonatology is a broad field. We can cover everything, but not everything is relevant over here. So it's very carefully curated content, very carefully selected speakers, or what I call instructors like me. So we all have experience of working on the continent, or either a lot of us live here, or a lot of us, like someone like me, we come and have spent extended amount of time working here. So basically we have a good understanding of the challenges that exist in this context, but also the unique opportunities. So it's really the partnership between people from outside, let's say people from some of the high resource settings. They bring their expertise and collaborate with the local experts. And I would say what sets it apart first is the partnership. It's a true, genuine partnership, as you may have felt throughout the conference. Everything is done together. So that's first. Second is another very unique, I would say, opportunity is for fellows and junior faculty. So here, it doesn't matter where in the hierarchy you are, so it's basically your expertise that really matters. And so you would have seen a broad spectrum of faculty who all bring their unique expertise. So it's really nice. It's very unique as well. Finally, why I personally love coming here is it's the diversity of the attendees. And again, diversity of the attendees from the continent. We have this year 23 African countries, and as I have worked on the continent, but I have only worked with people from 3 countries directly, or hospitals in 3 countries. So this is really a unique opportunity for me to understand the broader context. As we always like to remind, Africa is a continent, not a country, and we often forget that. So it's very, very important. And I think for me, this is just an unparalleled opportunity. And I would say I benefit more than, I guess, what I can bring to the conference, but I think it's definitely a great learning experience for me to grow as an investigator, to grow as a faculty. There have been many things that I've taken from here, from last year's conference learning to my own institution or the places I have worked. So yeah, long-winded answer to your question, but there's so much to cover.
Yes, and I love that answer, which brings me to one question related to what you said. What were you presenting about here? Just a little bit of a teaser.
Sure. Yeah. So my expertise in neonatal follow-up programs. So what happens post-discharge from the neonatal intensive care unit? So how can we ensure that our patients, so infants and their families, are doing well. They're not just, it's not just a survival, it's also if they are thriving, how are they do they have a good quality of life? So essentially, this whole field of neonatal follow-up is relatively well developed in high resource settings just because it's very resource intensive. However, there is a growing interest and leadership on the continent to start these follow-up programs. As we heard in the meeting, there are many countries already have some version of the follow-up programs. One of my presentation was how to start a follow-up program, or if you already have a follow-up program, how to strengthen it or take it to the next level. Also, our next, we did some workshops which are very application based, like we presented all this information. How will you use it in your own context? So yeah, it was all about post-discharge NICU follow-up targeted to the continent and how it could be adapted to different contexts.
And where do you have this research done in
so,
Africa?
So in Africa, my research, I initially came to Africa to start my research in Ghana. I have been still working in Ghana and love it there, and also in Zimbabwe. And I also co-lead, along with my colleague from here, the African Neonatal Association's Neonatal Follow-Up Consortium. We have many goals to improve both the delivery and access of neonatal follow-up on the continent. So yeah, so I have a little bit of idea about the different, I guess, health systems across the continent, but my first-hand experience is in Ghana and Zimbabwe.
Amazing. I love that you're tackling both West Africa and Southern Africa, which gives you a diverse landscape of what the follow-up system is like in Africa.
Yes, and we have been in kind of discussions for in East Africa as well for Uganda, and so it's just like it's a matter of time. Our goal is really to come up with some unique models that essentially can, be very helpful, not just for Africa, but for the rest of the world. There's a lot of opportunity for us to follow up to the next level.
Yeah, definitely. All right, so aside from being a speaker in this conference, how else are you involved?
Right. So I have a little bit of involvement in terms of helping the organizers to raise funds. As you know, it's very expensive to organize conference of this size in a venue like what we had, and so it takes money.
Yes.
Fortunately, I have been able to connect the conference organizers to my networks to raise funds. My hospital, University Hospitals, has been very generous in supporting as well, and so the conference banquet is sponsored by our hospital as well. So in terms of raising funds, but also in terms of figuring out what the content needs in terms of moving forward. So a lot of back-end work in terms of programming. But yeah, I would say if I have to pick one, it would be promoting and sponsorship.
Amazing. And that banquet was incredible. It was fun. And the energy was just what we needed to proceed with the week.
It's always the best part, and I must say that also sets this conference apart. The party. It's a great community we developed. And some of the people that I have met earlier, some of them I already knew. So it's like a family, and so it really works well.
Yeah. And how do you think others can get involved?
Well, very easy. We have a website. I'm sure there's a contact form. Reach out through that, and so I think if not, you can contact any one of us who is on the speaker list, and we'd be happy to connect. But I think the contact form on the website is probably the best way. We have some social media channels as well, so people can contact the organizers or other associated with the conference through those social media channels.
Oh, great. All right, there we have it. In a beautiful Arusha, as you can see, there's people around enjoying the scenery and the weather with amazing Sam. We've had such a lovely conversation with you, and yeah, hope to see more of you at this conference.
Thank you very much. Thanks for having me.